Nasikia kuna gari hapo pita pia tunapeana on offer. Hii wacha nipatie 600. Nipe 600. Hii ni Beats KCV 600. Hapa hii ni demo.
Yes, welcome my friends here to my channel. Today is another day we have to do something. Because I tell you, hey, today is hot today, man. Dust and hotness. I'm reading something here. Don't know if it's true. Yes, let's do something that is important, something that is worth it. So yesterday we did had a topic about ANC, antenatal care, complications and danger signs, headache, all those hypertensive disorders. Yesterday we did hypertensive disorders in pregnancy, and as you know, we categorize them into four. We categorize hypertensive disorders into four, and this one is we categorized it into one. We said we have something that is called gestational hypertension. Uncle is here. Welcome, Jamaican uncle. I'm going through what we did yesterday. We did something that is called gestational hypertension, and then we did a preeclampsia, and then we did eclampsia, and then we did chronic hypertension. Those are the three categories of what we call. Those are the three categories of what we call hypertensive disorders in. Yes, let me put that one. Hypertensive disorders in pregnancy. So we said there are several things we need to know about hypertensive disorders in pregnancy. One, we said there is one thing that we need to know, and this one is gestational hypertension. The systolic one is 140, the diastolic one is 90. So anything that is above that 140 over, that is more. So you are considered to be hypertensive, but now you are pregnant. If you're pregnant and you have that, we know that is gestational. But there is one important marker that we saw. When you are having high blood pressure and you are pregnant, and then you go to the hospital, and they check you, and we see that you have proteins in urine. What do we say? There is a problem with end organ damage. So this one comes and we say that you have preeclampsia. Welcome, my friends who is watching. Everyone who is watching, welcome to this live session. This is Dr. Benjamin doing his thing. I know Dr. Benjamin loves everyone. So welcome to the session. And as you come in, if you have not subscribed, subscribe to the channel. And if you are watching from where you are watching from, come to the chat and tell us, I'm watching from Arizona, US, I'm watching from this sector, I'm watching from Africa. Let's interact in the chat. And if you have any question, be free to ask. Michael Bez, hello, Michael Bez, hello, welcome, Michael Bez. Which country are you watching from? Which country, Michael, are you watching from? Welcome to the channel. Today we are talking about bleeding in pregnancy. And from Canada, we have a friend from Canada who is called Johnny Be Good, and then Christopher the General. So just stay tuned, you will see them coming in. People from Canada here, I have friends. Fang One Official, hey, who are you? I'm Dr. Ben. I come online and we discuss medical issues or go through my channel, my friend. Subscribe and go through my channel. There are so many good things in my channel. So Fang One, welcome to the channel. Hope you have subscribed to my channel. Michael Bez, hope you have subscribed where you are. And check my playlist on go to playlist. See Feel Good Evening. You will see good things there. People interacting, people feeling good. Check it out, man. So I was just going through what we did last time. we did hypertensive disorders in pregnancy, our women. And if you have a woman or a wife who is married, who is pregnant, stay tuned and learn something. Learn something from Dr. I can see, do you like being a doctor? Of course. People call me Dr. DJ, the DJ in the house. I like music and I love smiling. I love people. So when we are learning, we listen to music, we sing a bit and we interact. You see, yes, being a doctor is nice. When you help people and they recover, you feel good. But it needs a good heart. If you don't have that heart of being of persevering and being resilient, you'll not like what you are doing. So yes, Michael Bez, I like being a doctor. I like being a doctor. That's why I'm here to help people and discuss medical issues with people. Like one is, Michael, how long have you been a doctor? Since 20 what? That was 2012. 2012, 13, 14, 2015. Since 2015, imagine. Since 2015 till now. So Michael Bez, welcome to more people here like Jamaican Uncle. Interact with them. They are doing good. They have channels that do good. You're doing good job. Interact. Subscribe. I can see Fangwan has left. You must be a good doctor. Yeah, now you're talking. Now you're talking, Michael Bay. So, my guys, as you come in and you are a new person to this channel, man, don't like. It's the first time for Michael Bay being in the channel, you know, and we are vibing. Michael Bay, subscribe, bwana. Subscribe, hit the like button and subscribe, and share this. But I will tell you to check on my playlist. Check my playlist on a playlist that is called Feel Good Evening. You will like it. I have to go. Have a good day. No worries. Have some time and subscribe to my channel, Michael Bez, and come back again next time when more people are here. I'm just getting in, and I'm introducing bleeding in pregnancy, but there are so many things here in this channel. Well, I was doing a recap of last week. Last week we talked about something that is called hypertension in pregnancy. So I was saying that from gestational diabetes with no protein, with no proteins in urine, and it starts from 20 weeks. 20 weeks, that is like the start of the second trimester. After 3 months, pregnancy is divided into 3. First trimester, second trimester, third trimester. 9 months. 9 months. So 20 weeks, that is the start of the second week. Have a good day. Bye. You too, Michael Bez. Hope you have subscribed and liked and hit the like button, please. Yeah, so that we grow, and share too. Now, so when it starts when you have high blood pressure starting 20 weeks, and you have protein in urine, and you have headaches, and we call it preeclampsia. This is where we give you like magnesium sulfate. It's called tocolytics. It stops you to get to eclampsia, to have seizures. But when you have you through it and then you go to the hospital when pressures are so high and you have seizures, that is I am back. Okay. That is where now we say you have eclampsia. Eclampsia is the third one, which is bad. Eclampsia is it starts from the starting of the second trimester, and it starts as bad, man. It starts as bad because this one is you will get seizures. That one means you will get seizures. You get seizures. So we give you magnesium sulfate and antihypertensive to prevent seizures and bring down the high blood pressure. Then we have chronic hypertension, the fourth one. Chronic hypertension, that one, when you are pregnant, before even the 20 weeks are on, you have, when you go to the first visit, you start having pressure. You are told, your blood pressures are high. And then you are given medication. That is not eclampsia or preeclampsia. That is chronic. That is chronic what? That is, don't have a good day, have a great day. Hey, Michael Bez is a vibe. Michael Bez, thank you for tuning in. You're the guys that we need. One love. What we need is love to help life go today. Like Michael Blaze giving us some love. What we need is love to help life grow. Yes, Michael Blaze, big up all the time. You are a vibe, and we thank you for being on this platform. Continue having that spirit of interaction and social interaction. Now, we have said about what we did last time. Today we want to do another topic that is so important. A topic that is so important in women who are pregnant. In women who are pregnant. And this one, it entails very specific and many things that we need to know. Entails very, many things that we need to know. This one is a very important topic. And it's when you know what to do when you are having this, what I want to do, to tell you, it will save a life. It will save a life. Bleeding in pregnancy. Bleeding in pregnancy is the passage of blood from the vagina at any time during pregnancy. And it's common obstetric emergency. When you're pregnant, you're not supposed to bleed. And it can range from harmless to severe hemorrhage when you are pregnant. Imagine you're pregnant and you're bleeding. Spotting can be harmless, but now there is the bleeding itself that is more, the bleeding itself, the more bleeding. Welcome, my friends. As you come in, please, you hit the like button to increase the impressions. Yes, I was cleaning my camera. You see, it can be spotting to severe hemorrhage. So bleeding in pregnancy is not a good thing, and that is the topic of today. Welcome, my friends, and even those are first in this platform. Please hit the like button and tell us where you're watching from. Just come to the chat, text, tell us I'm watching you from this state, so that we know where we have a fast watching people who are watching us from. Big up every time. Don't just scroll. Watch and ask us questions. Here we learn about medical issues. Let me introduce myself again. I am Dr. Benjamin. Dr. Benjamin is here to discuss medical issues, mental health issues, and make people feel good. That's a vibe of every day. So if it is the first time you are watching me, don't fail to tell us at the chat. Don't fail to tell us at the chat, I'm watching you from this and this state. Yes. Don't fail. Like Michael, you see, it's Michael Bez's first day here, and it's a vibe, and we like it. And more people that are coming in, you'll see them coming, and then we interact. Desert Channel Explorers, Doctors Information. Big up every time, Desert Channel. We have a new friend, Desert Channel. We have a new friend called Michael Bez. Please bring Michael Bez to the show, and make sure Michael Bez feels, let me give you a jacket, so that you can help people here when they come. So Desert Channel, that is you now. You are invited as up. So welcome, my friends. Today we are discussing something that is called bleeding in pregnancy. Bleeding in pregnancy. It can be spotting, it can be severe bleeding. And what is the learning objective of this? What is the lesson that we need to know? What is that lesson that we need? Moderation much appreciated. Thanks a lot, Desert Channel. You have always been on this channel, and now it's time we link up, and I want to meet you. I don't know, you said you are in Laikipia. I want to visit the desert one day. Now, by the end of this topic, what should we have learned by the end of this topic? Defining bleeding in pregnancy. We should Laikipia. Yes, I have a friend in Laikipia. So when we plan to visit you, I will have visited him too. Now, defining bleeding in pregnancy, classifying bleeding according to gestational age, describe the cause of bleeding in early and late pregnancy, explain risk factors, recognize signs and symptoms, discuss diagnosis, explain management, and identify complications. Describe preventing. You are most welcome. Thank you, Desert Channel. Big up for your support and every time when you are here. Explain nursing midwifery management. We know first aid is the most important thing. What is bleeding in pregnancy? Bleeding in pregnancy refers vaginal bleeding during, before delivery, after conception. So when you have just you have just conceived, you have made love, you have felt good, and you see a baby have come. Now the lady tells you, you know what, my man, you know what, my man, I have not got my periods, and say you tell your empress, congratulations, empress, but you know. There are some people when they are told, you know what, I have not got my menses. Young chaps will run away like nothing else. So let's talk about bleeding in pregnancy. Bleeding in pregnancy means bleeding through the vagina after conception. You have made love and then the woman after conception starts to bleed. Early pregnancy before 20 weeks of gestation. 20 weeks is like how many? Those are 5 months, right? 4 divided by 20, that is 5 months. So you see, 20 weeks, you start bleeding and you are pregnant. And there is late bleeding, which is called antepartum hemorrhage. Late, after 20 weeks of gestation and before the birth of the baby. Antepartum, after 20 weeks. So after there is early pregnancy, the first trimester, the 3 months, and then there is antepartum after 3 months bleeding. So those two are different. You get to see that. Who is that watching and does not tell me where he is or she is? Tell me where you're watching from. Don't just come, you're watching Doc and then you're going disappearing. Don't disappear. Let's talk. And most welcome to my channel. Everyone, most welcome to my channel. Everyone who is watching. Dr. Ben is here, very much interactive, very much a vibe. People tell me that yesterday, someone told me that, Doc, we should call you the Minister for Entertainment. Because what you usually inject to us, you inject enjoyment. You take that syringe, as you give us the message, you inject to us the enjoyment. So enjoy this platform, enjoy my content, enjoy whatever we are discussing. Yeah, it is a good for people to say where they are. Yes, very important, man. Yes, you see, our visitor today, Michael Bez. Michael Bez is a vibe. He has told us watching from Canada. And I've told Michael Bez, wait, you will see here the General Christopher himself from Canada. Johnny B. Good from Canada, and you interact. Maybe you can meet here and maybe you get help from someone near you, So, classification, early pregnancy, below 20 weeks, you have just made love, you have felt good, and then your empress has told you, you know what, babe, I'm pregnant, I didn't get my menses, and then you tell your empress, congratulations, we're gonna get your mommy or your daddy. Wow! Now, after 2 weeks, 3 weeks, you start having spottings of blood. What can be this cause? Below 20 weeks of gestation. Below 20 weeks of gestation, that is like 3 months plus, 3 months, below 3 months. One, it can be miscarriage. One, it can be miscarriage. And what is miscarriage? Miscarriage is abortion, and abortion is either induced or there are several types. Induced, there is septic, there is how many types of why am I cornering? There is potentious, all those blighted ovum, all those incomplete, all those, you see, all those common causes of bleeding. Those are common causes, but that is one. Abortion, miscarriage, getting a miscarriage. But I've said bleeding in pregnancy when it is below 20 weeks. Yeah, it is a good for people to say where they are. Please tell us where you are watching from when you're coming here. Tell us which side and where you are. I can see people are here. Don't want to tell us where they are watching from. Come on, my guys, tell us where you're watching from. Let's interact. Let the session be can abortion also affect? Yes, that is one. In early pregnancy, less than 20 weeks, that is around 3 months, it can be the cause of bleeding. Ectopic pregnancy. People love taking emergency pills. People love taking emergency pills. They are prone to getting ectopic pregnancy. My friend, so you know right today, ectopic pregnancy, the causes. We will talk about ectopic pregnancy and management. There is something that we call molar pregnancy, and it is called hydatidiform mole. Molar pregnancy is something like a baby is growing, but it's not a baby. So that one can be a cause of bleeding. It really bleeds a lot. It's a mass that bleeds. You see, your woman tells you, I think I'm pregnant, because when I go to take the test, people, for a woman, if a woman misses the period, what she does, the first thing goes to the hospital to do a pregnancy test, or buys the kit and does it herself. So you can get, you are doing the pregnancy test. Yes, it is positive, but you are bleeding and you are having menses. That is what we call molar pregnancy. We will learn about it. You are pregnant, you don't have a baby. First of all, no, you don't have a baby, because molar pregnancy is not a baby. That is not a baby. But your pregnancy test is positive. You don't have a baby, but your pregnancy test is positive. Yes, my friends, who is that watching? Come in to the chat. Tell us where you are watching from, and give us your questions. Ronnie Hassan, hello everyone. Ronnie Hassan, today we are talking about bleeding in pregnancy. Ronnie, you have gone so long, or your job has been so tight nowadays. So you have said miscarriage, like abortions, ectopic pregnancy, molar pregnancy. I was explaining about molar pregnancy. Imagine taking a pregnancy test and it's positive and you don't have a baby. Just imagine. There is something that is called implantation bleeding. There is in your uterus, the implantation is not in the muscle, it is somewhere else. We will talk about that. Infections, cervical polyps, things growing inside the uterus. You get trauma during intercourse. It is the first trimester and the woman is hot like fire, and it is telling the person that he loves men, hit me like never, hit me like a drum. You I have been around, bro. There is a song, let me get that song. Sometimes when I'm teaching, I relate some words with the word hello desert. Hey, hit me like a drum. Hit me like a drum. Like a drum from Etana. The first trimester, the hormones are everywhere. The hormones are everywhere, and the woman is telling you, I'm hot like fire, hit me like a drum, hit me. Now, you can start bleeding. You can start bleeding because some people, listen to rockin' is the truth. What do you say, Etana? Ronnie, Hey, my friend, your woman is hot like fire because hormones are berating her. And then you're telling your woman, I will hit you like a drum. And Etana also said what? Etana said, hit me like a drum. Bleeding in pregnancy. Bala, you will make that woman to bleed. So that can be a cause of bleeding in pregnancy, you know. So when your empress is pregnant, it's the first trimester and the hormones are high. Tell the woman, let's go slow, my love. Let's go slow because I don't want to hit you like a drum. I don't know why Etana sang this song, yeah? Etana, tell us again. F2 just clicked in my mind. Etana, hit me like a drum. Go slow on your empress when she's pregnant at the first trimester. The first trimester is because you'll make this empress to bleed. It's trauma during sexual intercourse, you know. So we have said the causes of early sexual you know, you give information until you feel this information is getting so hard, and then you feel nice. So the causes of early bleeding in pregnancy, one is called miscarriage, miscarriage like abortion, ectopic pregnancy, molar pregnancy. I've said molar pregnancy is your urine is testing positive on pregnancy and you don't have a baby, something that else that is growing in your womb. Cervical infections, cervical polyps, and polyps are like there are some round things growing, muscular things growing inside your, and then we have trauma during intercourse. We don't hit them like a drum when they are pregnant. Don't hit them like a drum when they are pregnant. Now let pregnancy bleeding. Now that is after 20 weeks. After the first trimester plus 1 month. No, there is. F2 just clicked in my mind. Desert Channel, you still remember F2? Ronnie, what is there? Tell me what is there. What is there? Tell us what is there. Now, let pregnancy. Guys, if you are watching and it's your first day in this channel, please don't go without subscribing. You subscribe to the channel as we learn. You see, finance, F in us. What does that mean? Or is it am I getting wrong words or what? Because what I'm seeing is I'm seeing some other words. I think my translator is bringing some ish. My translator. Now let's continue. Let pregnancy bleeding. Common causes include placenta previa. Now placenta previa is where the placenta is attached to where it should not be attached. We will learn about placenta previa. F2 is still F2. F2 is not there nowadays. Is it there? I asked one person, let me go off topic a bit. I asked one person, if you are in Nairobi and you want to listen to reggae, good reggae music, which club do you go? Or reggae nowadays is not there, or people stopped going to listen to reggae music. I just want to go to a club one day, I sit down, I take my soda, and I listen to some Kokoti Man, I listen to some Gregory Isaac, I listen to some Alpha Blondy. Are those clubs still there? Please, if you know, tell me one. Tell me one where I can sit and hear my night nurse. All the pain is getting worse. Ahmed, big up every time. Ronnie and Desert Channel, we have a new friend. Peace be upon you. Hey, Ahmed is our new friend. Ronnie Hassan, Alex Ryan, sounding good, Prince. Alex Ryan, Alex Ryan, sounding good princess. Alex Ryan, welcome to my content, welcome to my, this is Dr. Ben, welcome to my platform. Here we discuss about medical issues. Ronnie brother, you understand Urdu? Ronnie, do you understand Urdu? I'm a villager, I'm not updated about the city. Come on, guys. Nowadays there is no village and up and down. Every place is a place, but even me, I'm feeling like relocating to the village because urban is becoming. Or am I getting old? Am I feeling like I'm getting old? No. Let's continue. We have said no hitting our ladies when they are pregnant like a drum. You get? No hitting our women when they are pregnant like drums, you know. No hitting our women when they are pregnant like... What is the topic today? The topic today is bleeding in pregnancy. Let me type it. Topic today is bleeding in pregnancy. Bleeding in pregnancy. That is the topic of the day. Bleeding in pregnancy. So, my guy, you guy, my guy, every guy who is watching, welcome to this channel. Let's smile together. Let's laugh together. Let's feel the vibe together. Let's be friends together. Share this live, my friends. Share to the people that you love. Share on your platforms. Let's bring in more women to listen to what we are talking about. You know, bleeding in pregnancy. This is very important. Bleeding in pregnancy. If it's your first day watching, big up yourself. You have just come to the right channel. This is where we feel good as we learn some things of health and mental health. But the topic of today is bleeding in pregnancy. So, let bleeding in pregnancy can be brought by placenta abruptio, placenta previa. Placenta being attached where it should not be attached. It can cause bleeding. Placenta abruptio. Placenta abruptio means placenta detaching itself from the muscles, the uterus, when the time has not yet come. Abruptio placenta. Yes? Vasa previa. That is a placenta. Uterine rupture. Your uterus can rupture because of high pressure, and then you start having contraction, so it can rupture. Cervical lesions, cervix can have some infections, can have you to have sores, wounds. So you see that can make you have some problems. Bloody show before labor. Causes of bleeding at 20 weeks and above. 20 weeks is 3 weeks plus 1 month. So that one, it means the second trimester. The first trimester, a woman carries a baby for 9 months. Yes? So we divide it into 3 months, 3 months, 3 months. The first 3 months is called first trimester. The second 3 months is called second trimester. And the third 3 months is called the third trimester. You see, and then labor, and then we have a bouncing baby kid there. We feel nice, you know, when a woman delivers and you've been waiting for a kid for so long. You feel good. But there are some men, when they are told, my friend, I'm pregnant, they run. Hey. They run like crazy. You know, we talk about running like crazy. Now, it is very important we see. Let me go back and talk about this information. We have categorized bleeding in pregnancy into 2. Like early bleeding in pregnancy, that is less than 4 months, the first trimester plus 1 month, and then we have late bleeding in pregnancy. What is late bleeding in pregnancy? Late bleeding in pregnancy is where you have more than 20 weeks. After 20 weeks bleeding. So what are the causes of bleeding in pregnancy at early bleeding in pregnancy? Miscarriage. Miscarriage is both by abortion, ectopic pregnancy, molar pregnancy, Muratozgu Muratos Go. What does it feel like to be black? Hi, man. I feel nice, boy. I feel good. Say hi. I feel good. And you, how does it feel to be white if you are white? I'm still asking you that question. You know, life is life, and whatever you enjoy. I'm Muratos Go from New Jersey White Association. Oh, New Jersey White Association. Good one. And I'm Dr. Benjamin from Kenya, Africa, my friend. So welcome to my platform, Murato. Welcome to my platform. Subscribe to this platform and share this to your association. Hi buddy, share this to your association. Let's grow. So when a woman is pregnant, one can be the cause. Are you going back to Kenya in Africa? Are you going back? No, I'm in Kenya. I'm in Kenya right now. I live in my country. I'm not in the US. I'm in my country. We don't want you in America. Oh, I don't want to come in America. Murato, I don't want. Maybe visiting, but I love my country, Africa. Don't worry, I will not come. Don't worry, I will come to visit and see how you live. You pay taxes and I come and enjoy my country as I am enjoying. So don't worry about it. You stay in your country, build your country. Murato, okay? Build your country. May God protect you. Nice one. Those are the things you should be texting. But Murato, build your country, pray for your country. Even me, I love my country. So don't worry. Don't live there coming to America. I will not waste time on you. You have a nice time. Let me continue with my topic. Now, miscarriage, pregnancy, molar pregnancy, implantation bleeding, cervical infections, and you are my best friend as long as you don't come. If I come to America, I'm coming for a visit, not to stay. I don't like staying away from my country. I love my country. You hear that, Murat? I love my country. You stay in your country, build your country. Trauma during intercourse. So let's continue. This is the second one. Late pregnancy bleeding. Common causes are like placenta previa, placenta abruption, vasa previa, uterine rupture, cervical lesions, bloody show before labor. Those are the late pregnancy. And late, we have said it is no, don't get me a visa. I already have it. I already have a visa, so don't get me. Don't. I can move wherever I want. You are a good guy. You should come to America, man. No, don't. I've just told me you what I can tell you. Yeah. Now let's continue. Let's learn now. Murato, it's time to learn. Let's not get into now the transitions and transitioning. It's time to learn. Early pregnancy. We have said about abortion. And miscarriage is a spontaneous loss of pregnancy before fetal viability. And fetal viability usually before 20 to 40 to 24 weeks, depending on local guidelines. So if you are in the US, check about the US, but they don't vary a lot. If you are in Asian countries, check about the Asian countries. And I know they don't vary so much, usually before 20 weeks to 24 weeks. That is early. You start spotting and bleeding. And when you are bleeding, when the fetus is at the first trimester, like 3 weeks, you may get something that is called abortion. So this is very important when it comes to, that's why it's divided. 20 weeks after 20 weeks. 20 weeks before, 20 weeks means 3, the first trimester. We have said a pregnancy is 9 months. So you divide them into 3. 3 months first trimester, 3 months second trimester, 3 months third trimester, 9 months. So that is how we divide them. You get it? That is how we divide these things. So types of abortion. Threatened miscarriage, slightly bleeding, slight bleeding. We will talk about this one. I'm just going through because now today we are talking about these things. Now, types, we have treated miscarriage. Yes? Imeisha. Bado anaumwa na chest.
Anasema sana sasa imesaidia
Kuna paracetamol hivi. Ama umpe oral. Acha atulie hapo kidogo. Then you repeat. Now, let's talk about this one, types. The types are like treated miscarriage, slightly bleeding, mild abdominal pain, cervix here is closed, and pregnancy may continue. You see, the pregnancy may continue. But we have, this is treated. You know, when you threaten someone is when you don't want to do it. You don't want to do it. It's threatening. So, this is slight bleeding, mild abdominal pain, cervix is closed, pregnancy may continue because it's just threatening. Here you may need some good bed rest. You have some good bed rest and everything is okay, you know. So we continue the inevitable miscarriage. Inevitable miscarriage. And what is inevitable miscarriage? Let me check on this. What is inevitable miscarriage? Oh yeah. Inevitable miscarriage. Inevitable miscarriage. Inevitable miscarriage is a heavy bleeding. Cervix is open. Here, you can do nothing. The loss has been done. You understand what I'm saying? The loss has been done. It is called inevitable miscarriage. Heavy bleeding, severe pain, cervix is open. Pregnancy here cannot continue. You remember this is the first one. Bleeding in pregnancy, in early pregnancy, the first 3 months. So when you have inevitable miscarriage, that one it cannot continue. What we can only do is to go to the hospital and we do some things. So the 2 things: cervical curettage or MVA, manual vacuum aspiration. We have incomplete. I know several people know some products remain inside the uterus and heavy bleeding occurs. Heavy bleeding occurs here, and then we have complete. All products are gone, bleeding decreased, pain subsides. You get to the hospital and we can do nothing. We just give you a bed rest, and after the ultrasound, we give you time to think and relax. Now, missed miscarriage. Missed is when the products, the fetus itself has gone, there is no bleeding, pregnancy symptoms disappear. Septic miscarriage is when you have an infection and you are pregnant below 20 weeks, the 3 months. You have fever, offensive vaginal discharge, and heavy bleeding. So the only thing here is this one that is called treated. That one is where you can, the fetus, the baby inside you can survive. But inevitable, that one is heavy, you cannot, it has gone. Incomplete, nothing. Missed, now the fetus has gone. You just remove it and life goes on. Septic miscarriage, you have infection. I remember I met this one for the first time when I started practicing septic. Hey, the smell itself, I felt like I can pass out. I had to go out and come back again when I'm prepared, you know. Ectopic pregnancy, causes of bleeding in pregnancy. The first one was abortion. First one was abortion, miscarriage. The first one was miscarriage. So those topics that I've gone through are of miscarriage. The second one here is called ectopic pregnancy. Ectopic pregnancy, my friends, how do a person get ectopic pregnancy? We talked about ectopic pregnancy. You like taking after pill, morning after pill. You are not ready to have a baby, and you don't have good protection, you are not protecting yourself, not using family planning, and things are good. And yesterday, my friend, when you are with your man, you are telling your man, you are telling your man, hit me like a drum. Etana, repeat that again. She was telling his man, you are telling your man to hit you like a man, and you forget that you don't have any family planning method. So what do you get? You get unwanted pregnancy. You can get unwanted. So for you to prevent before 72 hours are done, what do you get? What do you get? You run to get a morning after pill. These morning after pills, my friends, are not good. These morning after pills are not good because what do? They thicken the mucus and the mucary layers in your in your cervix and uterus, and even in the fallopian tubes. So if the zygote, the sperm and the ova should meet and they form the egg so that it comes to be implanted. So you have taken morning after pill at the wrong time, and then they become so thick. The mucus becomes so thick. So the products of conception, the sperm and the egg forming that egg, cannot come and be implanted. They stop at the fallopian tubes. So they are trying to swim to come. They have stopped because the mucary layer is so thick. Now the baby will not stop growing. It will grow there. You see, it will grow there. It will grow there. The fallopian tube. And the fallopian tube is not like the uterus, which can stretch and hold the baby. So it will burst and then you will start bleeding. So that is called ectopic pregnancy. Ectopic pregnancy. You get an ectopic pregnancy. Common size fallopian tube is 95% all. You can have even a pregnancy at the follicles, around the follicular areas. So risk factors for people who have to get ectopic pregnancy are pelvic inflammatory disease. Pelvic, that is infection in your pelvic area. It's very painful. Infections. Previous ectopic pregnancy, maybe you had a previous ectopic pregnancy. Tubular surgery, some people do tubular surgery and the tubes, the zygote cannot flow. Yes, another thing that I don't like, smoking. Smoking, my friend, is a bad thing. It causes cancer. Now it is causing ectopic pregnancy for our women. You see, that's why we say, women, when you are pregnant, stop smoking and drinking alcohol. Stop smoking and drinking alcohol, my friends. You stop smoking and drinking alcohol. You see, smoking can give you ectopic pregnancy. Congenital tubular abnormalities. You're born with problems at the fallopian tube, so the zygote cannot, after implantation, it cannot swim well to go and be implanted. Ectopic pregnancy. So what are the signs that this person has ectopic pregnancy? Lower abdominal pain, amenorrhea. Amenorrhea. When I'm saying amenorrhea, what do I mean? Is anyone who is watching who knows anything like amenorrhea? Or I'm speaking my words, I'm speaking my own words. Amenorrhea means you don't have menses. You don't have menses. You get. Then you have vaginal bleeding, shoulder tip pain. Here, shoulder tip pain. Sometimes you are dizzy, very dizzy. You have dizziness. Shock is ruptured. Shock is ruptured. So these are things. You see, we have talked about miscarriage and we have gone through the abortions. Inevitable, septic, incomplete, treated, or blighted ovum. Those are causes of bleeding in pregnancy. And then we have come to ectopic pregnancy. And you see, ectopic pregnancy can be caused by pelvic inflammatory disease, previous ectopic pregnancy, tubular surgery, smoking, in IVF, IVF, those women that your husband or you cannot get a baby, so you do what is this happening? I'm trying to do something and it is doing the opposite. And it's doing the opposite. So we do this. Welcome. If you are watching it your first time, my friends, you do what? Hit the like button, subscribe to the channel, and let's get to know a complex medical procedure where egg is combined with the sperm in the laboratory. IVF. So you cannot get babies and then we fuse and then we implant in your in vitro fertilization. We implant in your uterus. You get? We implant in your uterus. So those are the things that can make you have the problem of what? Ectopic pregnancy. So signs and symptoms: lower abdominal pain, amenorrhea, vaginal bleeding, shoulder tip, dizziness, shock if ruptured. You'll get shock. If it ruptures and you are bleeding so much, what will happen? You'll get shock. Diagnosis: pregnancy test, ultrasound, serum HCG. Serum HCG. There is something called methotrexate that helps this patient. Well, let me get to see methotrexate. Yes, welcome, my friends. We are talking about bleeding in pregnancy. If it's the first time here, don't fail to ask a question and don't fail to come to the chat and tell us where you are watching from. It's important we know where you are watching from, and we create a bigger society that we can interact from. Methotrexate is medication used. Yes, I've seen. It is used to it reduces the dividing cells, so the growth of the products at the ectopic pregnancy cannot grow faster. You see, dividing, that is, cells cannot multiply faster. So methotrexate, we do surgery and we give blood because this person is bleeding. Now that is ectopic pregnancy. We were at miscarriage, now we are at ectopic pregnancy. Let's talk about hydatid form mole. Hydatid form mole. This is another thing that I talked about, and I said hydatid form mole, it is called molar pregnancy. It means that you went to a doctor, you did a hospital, you did pregnancy test, and the pregnancy test became positive. The pregnancy test became positive. So if this pregnancy test became positive, where is the baby? You check and there is no baby in your womb. It may be a sign of hydatid form mole. You are testing, you are pregnant, but when they go and check an ultrasound, abnormal growth of placenta tissue is no viable fetus. You have the placenta tissues with no fetus. You don't have a baby, but the pregnancy test is positive because there is a placental tissues. So people that have in their genetic factors this problem may have this risk factor, and mostly below 20 or above 35 ages can have this. And what are the symptoms? Because it is called hydatid form mole because it is not a baby. They are just tissues growing, but your urine is testing positive. Your urine is testing positive. You see, if your urine is testing positive and you have, baby, they are just tissues. We call them hydatid form mole. One day we will talk about it at large. So how can you know you have hydatid form mole? Vaginal bleeding, excessive vomiting, enlarged uterus, because it's not a baby but some masses are growing. You see, very high HCG. When you go to take, when you take that, when your woman say, I'm pregnant, you tell your woman, go and bring the testing kit. You buy it over the counter. Whatever we check on that testing kit is just a hormone called HCG. If it is there, it draws a line. It shows it's positive. You see? So you will find so high HCGs and no fetal sound. So there is no baby, but there is so high HCG, that hormone. You see? Mostly, we do ultrasound to confirm, and high HCGs. We'll talk about hydatid form mole, so don't worry, we'll talk about hydatid form mole. Treatment is sanction evacuation, monitoring better HCG, avoid pregnancy during follow-up. Because if you get a pregnancy and you are bleeding and you have hydatid form mole, you will bleed so much. Welcome, my friends. If you are here, you have any question, it's your time to ask a question. Now, late bleeding. That one was the first part of bleeding. What about late bleeding? There is something that is called placenta previa. Placenta implants it in the lower uterine segment and partial or complete covers the cervix. Instead of becoming at the cervix here, it comes down. This one is divided into low-lying, marginal placenta, complete placenta previa, or partial placenta previa. You see, this is late. Now the placenta has been formed and it's not where it's supposed to be. So where it is causing bleeding. Risk factors: cesarean section, multiple pregnancy, twins, placenta previa history, when you are 35 years and above and you have babies, and smoking. You see, smoking is here. Clinical features: bright red, painless bleeding, recurrent bleeding, soft tissues, fetus usually not distressed initially. Malpresentation can occur. For you to get a diagnosis here, what you just need is an ultrasound. Avoid digital exam. It will make this person bleed a lot. When women go to the hospital, they do digital examinations. They bleed a lot. So here we don't do the digital examination. You see, there is something else that is called placenta abruption. We will talk about these things slowly, step by step. Placenta abruption is another one. The placenta just detaches itself from the uterus. Placenta just detaches itself from the uterus. You see? And when the placenta detaches itself from the uterus and the day of delivery has not yet come, what do you think will happen? You will start bleeding. You will start bleeding. Yes? Situmrelease. Ambia watoto mama asikuwa anaacha watoto wanaingia na pesha itu wako huko. Uambie wa mama si vizuri watoto kuzoea ndani ya hospitali. Umrelease. Fiona. Hi, Fiona. Hi, Fiona. Hope you are good. I can see you there. Welcome to the chat. Welcome to the chat. Welcome to the chat. Now, let's talk about something that is important here, placenta abruption. Imagine a placenta. Hello, everyone in the chat. Just a minute, my guys. Let me deal with this. Yes, we are talking about the second trimester. Burnout to be blessed is here. Fiona is here. Big up everyone who is here and coming. Blessings, Fiona from Uganda, the lawyer. Now, placenta abruption. This is late. Remember, we have said that first trimester is different from second trimester. So, we have divided pregnancy into 9 months. 3 months first trimester, 3 months second trimester, 3 months third trimester, and then delivery. That is another trimester there, and then we have a baby. Now count 20 weeks. 20 weeks from delivery. That is 3 months plus a month. You know, this one is called early bleeding, but above 20 weeks, the 3 months going on, that is less. So the first one, they are different. Miscarriages. You see, we have talked about miscarriages, late pregnancy. The first trimesters, that is early, less than 20 weeks. Trauma during intercourse, cervical polyps, infections, implantation, bleeding, molar pregnancy, ectopic pregnancy, and miscarriages. But late pregnancy, you have seen they are different. These ones are different. Mostly, they are complications of physical complications, like the placenta is not where it's supposed to be, and different things like ectopic pregnancy. As it grows, it starts to bleed. We have placenta abruption. Sometimes the baby is big, and then the placenta detaches itself from the uterus. You see, these are different, like the early ones. The baby is big. And abruption, what can cause placenta abruption? Hypertension, preeclampsia, trauma, smoking, cocaine use. People use cocaine and in pregnancy. Previous abruption, multiple pregnancy can be here. So when you have twins or more than 2 babies and you're pregnant, bed rest is always important. Even if you do exercise, do a small exercise. So let me welcome Burn Up to be blessed. Let me welcome Fiona. Everyone who is watching, subscribe to this channel, man. What are you waiting for? Tell us to the chat, Bwana. Come to the chat, tell us where you are watching from. Which part of the country are you watching from? Guizera, 2005. Hey, I can't read that, my friend. I can't read. Is that Spanish? Guizera, is that Spanish? What are you saying? I understand English. Wizera, which part of the world are you watching from? If you are here, you are new. Let's get to know where you are. Where you are. Where are you from? Yeah. Oh, we're talking about football. Okay. Nice one. So if you are watching, but not to be blessed, blessings. Welcome to the chat. Blessings to everyone who is watching and who is on chat. If you are here, you are new, tell us where you are. Tell us which part of the world you are watching from, and subscribe to the channel. Also subscribe to the channel. Now, placenta abruptio, that one you have said, when the placenta is detaching itself from the uterus. So we will talk about these things one by one. We will see about causes of early bleeding in pregnancy and late bleeding in pregnancy. So what is the symptoms of placenta abruptio? What can show you that this placenta has detached itself from the uterus? What can show you that this placenta has detached itself from the uterus? Sudden severe abdominal pain. Sharp one. It's very sharp, severe abdominal pain. Dark vaginal bleeding. The blood that is coming there is totally dark. Yes? It's totally dark. John. It's totally dark. And tender rigid uterus. You feel like the uterus is kind of rigid. See, fetal distress or absent fetal heart sound or maternal shock. These ones can be the problem. How can we diagnose? We diagnose by assessment, doing an ultrasound, blood test, and continuous fetal monitoring. Continuously monitor the fetus. You see, you continuously monitor the fetus. See, it's very important, my friends. What do you think? This is very important. There are some things when we talk about them, now you may feel it's a story, but wait until you have someone who is suffering from these things. That's when you'll know this is not a story. So everyone who is watching, if you are here, still here, tell us you are still here and you are watching from where. Tell us which side you are watching from. And we do interact. And if it is you are new, you know what to do. Hit the like button and subscribe, man. Give me your subscription. Don't just go. Hit me your subscription. But tell me where you are from too. It's important. So there is something that is called vasa previa. Fetal blood vessels run across the cervical opening without protection from the placenta or umbilical cord. The fetus is growing and the blood vessels are running to the cervix. So they may get trauma and they may bleed. They may get trauma and they may bleed. You see, here, if it is the second trimester and you are at 35 weeks plus, and the only thing you can do here is cesarean section. You cannot deliver normally. This one because if you deliver normally, when the baby is coming out, he'll rupture the blood vessels. The baby will rupture the blood vessels. So here we just go to fear, and delivery is by CS. We have something that is called uterine rupture, a tear through the walls of the uterus. If you are trying to give birth normal way and you have a previous scar, let's say you got the first baby and it was a cesarean section. Then the second one, you should check, because when you are trying to push, the scar may rupture and you may bleed. Or there are some labors that is obstructed. You are trying to push and the baby is not coming out. Or trauma. Sometimes you may try to give birth and you are pushing and you are pushing and you are putting in some instruments to push the baby and they rupture your uterus. And there is a drug that we use to induce that is called oxytocin. It makes the uterus contracted, contract. So the contraction can make your uterus to rupture. Sudden severe pain, vaginal bleeding, fetal distress, loss of uterine contraction and maternal shock. Those ones are the signs. This one is emergency. This one is an emergency. Once your uterine has ruptured, it is an emergency. We need blood to transfuse you. We need to repair the uterus, and or sometimes even we remove it because now it may bleed so much. Theater direct. So uterine rupture, the uterus can rupture if you have a previous miscarriage, previous cesarean section, hypertension in pregnancy. Women, let me tell you one thing. A woman asks me a question like this one. When am I supposed to go to the clinic? When am I supposed to go to the clinic when I'm pregnant? When am I supposed to go to the clinic when I'm pregnant? When I notice that I'm pregnant, I usually tell them, immediately you know you are pregnant, you just go to the clinic and do the random test that we do. And you know the random test that we do when women are pregnant is we do the urine test. We do the urine test to see if you have infection and you have proteins in urine. We check your blood to check your blood levels. Those are the normal things we do. And they may tell you earlier, and even the blood pressure. The blood pressure itself. The blood pressure itself. You see, even the blood pressure itself. You see, the blood pressure can make you have what? The blood pressure can make you have to know that you have a problem in future. You see, so these are things that we should be checking on them. These are things that we should be checking on them. Just a minute, I hear what I'm being told here. My guys, sorry about that. So we were continuing with this topic, and I think it's important that we continue. Welcome again to the talk. You know, sometimes as a dog, you come online, you come online, and then you get engaged somewhere else, and then you leave, and then it hangs, and then the topic hangs again. Now, we have talked a lot today, my friends. We have talked about bleeding in pregnancy, and I know people are learning about bleeding in pregnancy. It's a very important topic. Bleeding in pregnancy is a very important topic because it saves life. You know, it saves life. You as a person, and you see someone is bleeding, you can save life you can just save life by trying to help this person you can just save life by helping this person to do what? To know the right way to do things. Severe headaches, you know, heavy bleeding. Here is where mental health comes in. I can see T-Beauty, my beautiful friend from away, my friend. Hey, T-Beauty, your boyfriend can give me jabs if he hears me calling you my beautiful girlfriend. Hope you are doing good, T-Beauty. We have really talked good and good things here, like hit me like a drum. We are talking about bleeding in pregnancy, and we have divided it into two. Yes, we have divided bleeding in pregnancy into two. Early bleeding in pregnancy and late bleeding in pregnancy. Early is below 20 weeks, late is above 20 weeks, and they are different. Miscarriages are below 20 weeks. I'm doing great, by the way. I like it. Hope today you don't have fatigue. I was online and then I ran away. I'm still in hospital. When you see me wearing this, just know I'm on duty. I'm on duty. So I'm live and I'm being called, hey doc, come here, do this, come here, do this. So every friend that is coming, God loves you. God loves you. Have you ever had a friend that was pregnant and was bleeding? Today you will learn about, you have learned and you have gone through the late bleeding and like this one that is called vasa previa. Vasa previa, vessels that are passing through the cervix instead of being on the uterus and the way it is coming. This one, it needs emergency cesarean section. Emergency cesarean section. Ectopic pregnancy. You know. What are the signs of ectopic pregnancy? Ectopic pregnancy. We have talked about ectopic pregnancy. This is placenta previa, things that you are placenta abruptio, vasa previa, uterine rupture. The uterus can just rupture. You see, you can be pregnant and the uterus ruptures. That one is an emergency. People that have multiple fetus, you have twins, you are carrying 3 or 4, the uterine can rupture. You have to check the hospital. If you are watching and it's your first time, please tell us to the chat which side you are watching from. Let's interact with you. Let's be friends. You know, being friends is a great thing. So, causes of bleeding in pregnancy, we have talked about them. Infections can make you to bleed in pregnancy. Marjorie is here. Blessings, doctor, and everyone. I can see you are like, wow. If you are coming and you have not liked, smile with me. Girl, smile with me forever. And I said, smile with me. So, bleeding in pregnancy, let me give that recap of bleeding in pregnancy. We said they are divided into two, into early bleeding in pregnancy and late bleeding in pregnancy. You see, so early bleeding in pregnancy are things like abortions. We have named the types of abortions. Ectopic pregnancies. Ectopic pregnancies, we have talked about it, but we will learn about ectopic pregnancy in bigger, wide scope. Molar pregnancy. Smile with me, Jamaica. And where is Jamaican uncle is here listening. Now, molar pregnancy is whereby you do a test. It is turning positive, but you yourself, it is positive, but you yourself, you don't have a baby. You have tissues that are making you have positive. Imagine you are doing T-beauty. Just imagine you go and do a pregnancy test. It is positive. And you don't have a baby. Imagine. That is called molar pregnancy. Tissues that are making you. And if you touch the uterus, it is tight, you know. Implantation bleeding. Your placenta is implanted at the wrong place. Cervical polyps. Polyps are not good, they are bad. Trauma during intercourse. And that's where we were singing Hit Me Like a Drum. You know, when a woman is pregnant, hormones are running and they are making him have, they say, I'll pass out if it says positive. You don't pass out, you embrace the occasion. You know, when you embrace the making love and you feel good, be ready to embrace the occasion of having a baby. God is great. Making babies is a sweet thing. So it's bringing life, and that's why God made it to be sweet, making babies to be sweet. So when it is positive, you need to say congratulations. Congratulations. You need to say congratulations. God, thank you so much for making me pregnant. Making me pregnant. So you see, ectopic pregnancies, cervical polyps, sexual intercourse that cause trauma, those are early bleeding. But there are some complicated issues that can come after 20 weeks, more than 20 weeks, like placenta previa, placenta abruptio, vasa previa, uterine rupture, cervical lesions. I've explained these things. If you are coming late, you can rewatch this and you'll know what is placenta previa, what is vasa previa, what is uterine rupture. How do a person get a uterine rupture when he's pregnant? You see, bloody show on labor, all this, you see. So bleeding in pregnancy is not a good thing. It can be spotty or it can be abnormal, a lot of blood. Causes of bleeding in pregnancy. Early bleeding, we have talked about them. Now, there is something that I want to discuss here that is important. Things that when you go to a hospital, you should do. When it comes to bleeding, you have gone to a hospital and you are spotting you are bleeding, they should check your blood count, complete blood count. They should check your complete blood count to see your hemoglobin levels. Because if it is less than 11, 9, 10, 11, less than 11, you will start feeling dizzy and the baby will not have enough to sustain it. Not having enough oxygen is a very bad complication when you are pregnant. You see, so go to a hospital, they do blood count. There is this that is called blood group and rhesus factor. Blood grouping and rhesus factor, because if you are pregnant and you are losing blood, we need to know the type of blood that you have so that we earlier get your blood. We work on getting your blood for transfusion, you see. And rhesus factor, you have seen something that is called anti-D, rhesus isoimmunization. Your blood is fighting the fetus, so we have to inject you with the anti-D so that the fetus inside you cannot die, because your blood can kill the fetus. I will explain that. We will talk about something that is called rhesus isoimmunization. And you've heard about some women that go to hospital, they are given an injection that is called anti-D at specific days, early and then before delivery and after delivery. It's because if they are not given that injection, the fetus will die inside. Because your blood mixing with the baby, it may bring bad things. Yes, we will talk about it. So stay tuned. One day, very soon, we are talking about rhesus isoimmunization, cross-matching, coagulation profile, serum HCG in early pregnancy. So there are some things like obstetric ultrasound. Check the baby if he's okay. Fetal heart rate. Gestation, how old is the baby? Is the baby normal in ultrasound? Doppler's ultrasound, when a woman is having deep vein thrombosis. A woman can be having deep vein thrombosis, DVT, and when the baby is growing, the uterus is lying on some blood vessels, and most of the time, women, you will see them, they have limb swelling. Mostly the left limb. So that one is called deep vein thrombosis. So we do something that is called Doppler's ultrasound. When we do Doppler's ultrasound, what it does, it helps us to know how to manage that woman till the baby is delivered. And then there is something that is called biophysical profile. Biophysical profile. So I can see people coming in. If you are listening to Dr. Ben here, tell me where you are. Don't come to the chat. Tell us I'm watching you from this side and I like what you are doing, or please tell us about this topic. I will really love to know what topics you want me to talk about, because here we talk about random issues. Like this week, we are talking about bleeding in pregnancy. And someone may ask something. What is this biophysical profile? Is a prenatal test used to assess the well-being of the fetus in pregnancy. Yeah? What is the purpose? Assess fetal well-being, detect fetal oxygen levels, identify fetal if it is at risk, determine whether the pregnancy should continue or delivered if necessary. So there are some things that we check on biophysical profile. Assess fetal heart rate, fetal movement, the fetus, is it moving, the heart rate, gross body movement, observed on the ultrasound. This one needs you to have an ultrasound. Muscle tone, is the fetus having a good muscle tone? You see, amniotic fluid, the fluid that the baby is in, is it enough or is it too much? You see, so we write something down. We see breathing, body movement, muscle tone, amniotic fluid, and the maximum score is 10. 8 to 10, 6. We will learn about it very soon. We can do it even today or tomorrow. So anyone who is watching and is feeling good here, tell me where you are watching from. So that one is called biophysical profile. So we have learned a lot today about bleeding in pregnancy, and there are key things that you need to know about bleeding in pregnancy. Very important things that someone needs to know about bleeding in pregnancy. And these important things are one, pain. Do you have pain as you bleed? Because bleeding is there. If bleeding is there, is it bright red or dark red? Because bright red means is something like placenta previa. Dark red means it is coming from the placenta abruptio. The blood is coming from the muscle. You see, very important. Who is watching and has not liked? If you have not liked it, if you have not liked, continue give me the like so that we increase the impressions. And tell us where you're watching from. Tell us where you are watching from. So you see the main key components. Pain. Are you bleeding and it's painless? If you have placenta previa, the placenta has attached itself where it's not supposed to, the pain won't be there. You might be bleeding, but the pain is not there. But when you have something that is called placenta abruptio, the placenta has detached itself from the muscle of the uterus. It's painful because that is a wound. Then we have bleeding itself. Is it bright red or dark red? Is it bright or dark? Dark is placenta previa abruptio. Uterus, soft, non-tender, or is it tender and rigid? You see things that we check on. These are very important things when it comes to assessment of the bleeding itself. It will tell you if it is an abortion, a miscarriage. It will tell you if it is a placenta previa. And I've said placenta previa is where the placenta is attached where it's not supposed to attach. And it will tell you if it is a detachment, abruptio. Placenta is detached from the, you see, key things we should check the color, talk about pain, fetal distress. Check on the ultrasound if the fetus, if it's having a distress. Check on the vaginal examination. Avoid you until diagnosis confirmed with instruments of confirmation. when you suspect a patient or a woman is having placenta previa, you should avoid examination. You know, some ladies, when they go to hospitals, and the first thing the doctors do, they insert some digits. There. You may worsen, if this person is having placenta previa, you may worsen it. It may be worse. The bleeding may continue. So you have to do an ultrasound to confirm it is something else. So this idea of women going to hospital and you are there very fast, putting your fingers there, examining the show, no, don't do that. You may bring problems. If this woman is bleeding and is painless, don't be fast on examining with your digits. Even if it is a placenta abruptio, because you may worsen the situation. So kindly, if you have any question, my friends, please bring that question up. Let's talk about it's time to ask question. We have talked about bleeding in pregnancy. We have talked about bleeding in pregnancy, and I've seen many people have really been listening keenly on this. If you have any question, anyone with any question, is your time to ask about anything about bleeding in pregnancy. Please ask any question that you have about bleeding in pregnancy. Who has any question, my dears, my friends? If anyone with any question about bleeding in pregnancy, you are invited. As I'm checking on something here. We started by hypertension in pregnancy, high blood pressure in pregnancy, and today we are doing bleeding in pregnancy. So bleeding in pregnancy, you see, it has several things. Bleeding in pregnancy, you have noticed, it has several things, very many things. We have gone even to the biophysical profile, where we see oxygen, lie, muscle tone of the baby. You see, so we have here things that we need to do. We will talk about miscarriages, ectopic pregnancy. We will start by early pregnancy bleeding tomorrow, and then we will go to late pregnancy bleeding. So miscarriage, we will talk about it. Ectopic pregnancy, we will talk about it. Molar pregnancy, we will talk about it. Cervical infections, we will talk about infections in pregnancy, and cervical polyps and trauma during intercourse. Those ones we will talk about them. And then we will talk about late bleeding in pregnancy. Late bleeding in pregnancy, we will talk about placenta previa, placenta abruptio, vasa previa, uterine rupture, cervical lesions, and bloody show. We will talk about all this because they are important. You see, they are very important. Then we will jump to late. Now the complications come to late pregnancy. Late pregnancy, I know, here is where people will ask so many questions. Here is where people will ask so many questions. Questions that are complicated. Because if you tell someone placenta previa, it is divided into 4. This person will ask you, please tell us where, how. I will come with diagrams and I'll explain. Low-lying placenta, vaginal placenta, partial placenta previa, complete placenta previa. We will talk about this. And you know they are different. When we talk about placenta abruptio, we will see the grading as we see. You see, bleeding is not just bleeding when a woman is pregnant. It entails specific things. And that's why I'm telling any health worker that is here, when you are a health worker and you are here, please don't be in a rush. Please don't be in a rush to do digital examination. Don't be in a rush to do digital examination, because you may worsen the bleeding. So no one has a question today. people who are watching. I can see we have so many new guys in the chat. Today we are blessed with several people who are new, and they have come and gone. Although I had to check out a bit, I had to go out a bit. So we have started bleeding in pregnancy. It's a very wide topic. This bleeding in pregnancy is a very wide topic. It's a very wide topic, and it may not take a week. We will go slowly by slowly, and people will understand. It's Joya, always your time, 6 o'clock. 6 o'clock, it's your time, it's Joya. Dr. Benjamin, greetings, it's Joya. Big up yourself. Thanks a lot for tuning in. We have been talking about bleeding in pregnancy. Bleeding in pregnancy. And so, if it's Joya, you have ever seen someone bleed in pregnancy, you will learn a lot. I've introduced the parts, the first part of bleeding in pregnancy and the second part of bleeding in pregnancy. So you, as we continue learning, if you are coming in right now, you know what you do. You come in and like the topic, like the chat as we continue. Because we have gone through the introductory part. Majay, I see you. Greetings to you, Majay. I've done the introductory part. Like is done. Thank you so much. It's Joya. Thank you for giving a like. Big up all the time. And it's Joya. What time do you do your premieres? I miss your premieres every time. Or your lives. I miss your premieres and your lives every time. So that is it. You know, bleeding in pregnancy can bring anemia. Bleeding in pregnancy and anemia. So we should secure, let me say, complications of bleeding. I give complications of, as I am going to end, let me give those complications. Of bleeding in pregnancy. Complications of bleeding in pregnancy. There are several complications. You know, the fetus can die, the hypovolemic shock. You can get anemia. DIC, disseminated intravascular coagulation, a life-threatening condition where you are just bleeding. Even the clotting factors are not working. And you know, if you continue to bleed so much because you are bleeding, and bleeding is because of a wound, you may get an infection. A woman who is pregnant with an infection is not good. You may get an infection. You may need blood transfusion. And you see, those are some things. And when you get blood transfusion, Dr. Ben, don't worry. Wherever you meet my live stream, you can join. Most welcome. Oh, I was asking about time. You know, because most of the time I get into, when I get someone on when I get someone on a live, even if I don't comment, I just I usually just watch silently, and I leave it to run. Let me check it where you see. Okay, you see, so emergency surgeries, those are not good things. They can be prevented early. And you know, when you bleed a lot, a woman who is pregnant with more demands of life, the kidney might suffer something that is called hypovolemic shock, severe shock, reduced blood flow in the kidney. If your kidney gets less blood that is flowing in, it may lead to shock, and that one we call renal failure, kidney failure. Your kidney has amount of blood that should be running in it so that you'll be okay. And then you can have multi-organ failure, several. So bleeding is not a good thing for a mother, but even for a fetus, reduced oxygen, blood flows to the fetus, delivers oxygen. You get prematurity. A fetus that is, you go to hospital, and tell you, because this fetus is having a problem, we have to deliver it to go to the incubator. You stay in the hospital for so long, things that we should prevent. And you know, if your fetus is not getting oxygen, if your fetus is not getting enough oxygen, what can happen? It can die. Sometimes you get babies being born with low weight. These are complications. They are divided into maternal and fetus. Hypoxia, oxygen levels to the fetus are low. Neonatal death and birth asphyxia. These are complications that are for the woman who is bleeding. So we will know how we can prevent bleeding in pregnancy. You see, it's a very big topic, and I know people not like how to prevent. I remember in surgery class, the first when students go to start surgery, they think they are going to start. They are going to the theater to learn how to do surgeries. No. When you start surgery, the first class you start with is prevention. Because if you prevent people from getting damage, they will not end up going to theater. You see? So let's learn how to prevent damages like these ones, like bleeding, and we will learn. So tomorrow we are starting with early bleeding in pregnancy, and you said early bleeding in pregnancy is less than 20 weeks. And I've divided pregnancy into 9 months. First trimester 3 months, second trimester 3 months, third trimester 3 months. That entails 9 months. So 20 weeks is 3 months plus 2 weeks. So it means below that is early. The causes of bleeding below the 3 months plus 2 weeks are different from the ones that are more than 20 weeks. The second trimester end, you see, because miscarriages, most of miscarriages happen at below 20 weeks. You see, most of things like fallopian tubes happen after 20 weeks, when the fetus is growing and is in the fallopian tube. It is rupturing the fallopian tube. Those ones may happen after 20 weeks. The placenta has formed. That one is after 20 weeks, where the placenta is formed and is implanting. You see, placenta abruptio after 20 weeks, when the fetus is becoming big and maybe you have multiple pregnancies, it is becoming heavy, so it is detaching itself from, and maybe you are doing physical exercise a lot, detachment from the uterus. You see these things, very important things that we are talking here, my friends. I wish people could know how important these things are. So we talk about them and we talk about prevention. We are saving someone's life. And wherever I go, I say alcohol, and I wish KMTC students could discover this channel and get essential lessons in new topics. They usually watch It's Where after we have come live, I see some people, some students calling me, asking me, hey, you talked about this, how can I do this and this? It's Where they usually watch. I went to an institution, I will not name the institution, and every student was saying hi to me. Hey, dog, hi. I asked them, how do you know me? They told me, we watch you, we follow you, and we learn through you. You are a very funny guy. You entertain us and we learn. That's when I knew, oh, okay. That's so it means that I've gone so yes. So this is it, my friends. Thank you for tuning in. Unless anyone has any question about bleeding in pregnancy, or let's say any question, if you have been watching or you have just come in, let's get up or one or two questions before I leave. Let me get like 1 or 2 questions. Let's get 1 or 2 questions before I leave. Just think of something. You know I love questions. Think of something. Kaden, Kaden, K. Hello. Hey, Kaden. How are you doing? Is it your first day here, Kaden? Yeah? Is it your first day? Greetings to each and everyone. My sisters are nurses and one is a pharmacist. Oh, okay, that is nice. Hope you have shared this channel with them, it's sure. Hope you have shared this with them. That is great. When you meet people that are at the same cadre, the same line of duty, you feel good. Share with them this channel so that they can be assisting me when I'm live. You know, when they are pharmacists and I am asking a drug, their molecular values and their molecular weights, they can help me when I'm live, you see. Kaden K, are you in Kenya or which country? Is it your first day in this channel? I'm asking anyone with any question before I end. I like answering questions. I like answering questions. I'm waiting for only 1 question before I leave. Today I'm not leaving. I have time today. Today my patients are not stubborn. They are not up and down around me. Anyone with any question before I leave? I'm waiting for only 1, 2 or 2 questions. I like answering questions. Yes, but you've seen bleeding in pregnancy is not a good thing. So many things can lead to someone to bleed in pregnancy. You have seen that, You have seen that. And it's a complication that is not good. It's a complication. So if you're coming in, you have studied. So I have introduced the topic. I have talked about very many things. I have gone deep and deep. So if you are coming right now, I hope you will rewatch. But I'm still waiting for a question. Any question from anyone about bleeding? I'm not going home without Yes, Joy 5. She knows you just she kind of busy with patients too. Oh, Joy is your sister. Yeah. Oh, nice. That one is nice. That one is very nice. Thanks for sharing. Thanks for sharing. Doc, smell of some perfume irritation. Okay, because you are hypersensitive. When you are getting there is some things that you cannot change in life, like hypersensitivity. So when you get the smell of the perfume, do you sneeze or do you do what? You sneeze or do you cough? Because when you get the smell of the perfume, you inhale and it irritates you, you cough. It means you are releasing histamines and the mast cells. So the mast cells release histamines and then they constrict airway and then you sneeze. There are some people who are born with hypersensitivity, just like allergies. They are prone to, these people are prone to allergies, hypersensitivity. There are cells that are called immunoglobulin G, immunoglobulin E, and immunoglobulin M. So IgE, let me see. Those cells are sensitive to irritants. So IgG, there is another, the one that is called IgG. That one is, IgE is for infections like protozoas. And IgG is, let me see, infections also. And IgM is for, good morning, doctor. How are you doing today? Happy Thursday. I'm fine, Grandmouth 3. I usually say, welcome, Grandmouth 3. You know, I'm a father of 3. So your grandma of 3, I'm a father of 3. You can relate, antigens. So the one that is in your mucus layer, the irritation is called IgM. It is the one that releases sneeze. Yes, you are hypersensitive. So your immunoglobulin M are so sensitive. When I like your blue t-shirt, this one is a hospital shirt. This one is a scrub. I've put on a scrub for the hospital. A scrub for the hospital. Yes. This one, you see, it's a scrub for the hospital. Today I'm at work, I'm working. So you are maybe you are hypersensitive to this immunoglobulin M. It releases mast cells and histamine, so you constrict airway and sneeze. There are some people who are born with this and you can do nothing. The only thing that you should do is to avoid irritants. There is no cure of this. The only way we do is when you get to a hospital and you have been sneezing and coughing a lot because of the irritation, we reduce it by giving something that will reduce the irritants and the irritation. So Manje, now that you know you are hypersensitive, we call that condition hypersensitivity. You have IgM hypersensitivity. Avoid irritants. If you go near people that have, you put on a mask. You are dust. You stay away from dust. You stay away from things that will irritate you. You get? You stay away from things that will make you sneeze a lot. You stay away from things that will make you be hypersensitive. But today the topic was a good topic, but bleeding in pregnancy. The topic today was bleeding in pregnancy, and I'm still waiting. I'm so glad that I can actually hang out with you today. Thanks a lot, Grandma of 3. Thanks a lot for being here. We have been happy birthday, Dr. Benjamin, watching in the background. That one was my daughter's birthday, not me. Seraline. You see it's written Seraline. It is my daughter's birthday. Mine passed. My birthday is around March there. So that one was my daughter's birthday. So, 2 days ago. A day ago, not 2 days ago. A day ago. Yeah. So we have talked about bleeding in pregnancy, and we have seen different types of bleeding. If you have just come late, I'm waiting for happy birthday, sweetheart. I'm wishing you many, many more blessings, happiness to come. God has planned for you. You are amazing. Yes, Einstein, watch those comments. She watches me after school. It is 6:30, and I know I know she's watching and reading these texts. You know, sometimes when my daughter is on TV watching Burnout to be Blessed and the name Queen or Jamaican Uncle or Marwa, she's the one who texts to people and tell them, congrats, thank you for this. And when I'm online and I'm not home, she's always watching, and she fears texting because she's using her mother's phone. So I know she's watching and reading these comments. I'm reading these comments. So thank you everyone for your support. It has been 2 hours of blessings as I deliver the content. Yes.
Katika kile box nilimpatia. Amechukua kila box kuna na 8 hakunywe zote sio 8.
Hapana. Ameza strip moja ile. Kwani alimeza nani?
Ndio amelenda kumana kwa kutoka moja.
Hiyo strip nilitoa, ameza hiyo strip moja. Hivyo.
Okay, sawa.
Tell her thanks. Yes. She calls you our auntie that talks slowly and calmly. One day she told me, I've been watching the auntie that is talking calmly and slowly. I asked her, who is that? So she put your video and tells me, Queen, Auntie Queen. Inspirational aunt. So you just know you are the auntie that talks slowly and calmly. Our inspirational aunt. And Jamaican uncle. But she calls Jamaican uncle at times. She is a friend. When Jamaican uncle was here, they met. And they like each other. They like joking around. So Jamaican uncle is a friend to her. So when she'll be big and start her YouTube channel, right now, let her concentrate on studies. So guys, 2 minutes to go and I've not got any question. But today we have done something that is important. We have done bleeding in pregnancy, and we have seen some new good people around, and Kaden K has been here, several good new people. So if you are here watching and you have just come now, you get a rewatch, you will understand. This one has been an overview of what we did, what we need to do. Happy birthday to your daughter. Tell her those words. Yes, when I get home, I'll tell her. And she's watching, she's reading these texts. She watches. So we will 1 minute to go. And we meet maybe today at 10. At 10 we meet to discuss one of the early bleeding in pregnancy under 20 weeks. Thank you so much for being here. If you have come late, rewatch and share. I leave for now. It is 6:30 p.m. I've been here for 2 hours. May you be blessed for coming in. Bye bye. See you guys.